Welcome to today's webinar titled TRICARE Mental Health and Substance Use Disorder Services. We are thrilled to have with us today Dr. Christina Biana. Dr. Biana is a clinical psychologist, clinical support division with the Defense Health Agency. Without further delay, I will turn things over to Dr. Biana.
Hi, everyone. I'm going to be speaking today on mental health and substance use disorders. So let me start with slide 2 and the disclaimer that I'm instructed that I must read word for word. It says, the appearance of hyperlinks does not constitute endorsement by the Department of Defense of this website or the information, products, or services contained therein. For other than authorized activities such as military exchanges and morale, welfare, and recreation sites, the Department of Defense does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this Department of Defense sponsored webinar. So with that, I will do a little bit more of an introduction. My name is Chris. I work for the Medical Affairs section of the Defense Health Agency here in Falls Church, Virginia, and I have been with this group for about 5 years now, and I'm one of the lead government people now on the mental health and substance use disorder benefits. So I'll talk about the changes and what has happened over the last couple of years, and then really spend a lot of time talking about the current benefit and what great things TRICARE has to offer. So with that, I'll go to the next slide, the agenda. So today we'll cover what, in fact, are the covered services. We'll talk about, like I said, the updates. We'll talk about how to get mental health services. We'll spend some time talking about referrals and authorizations because that's a change that is notable that has occurred over the last couple of years. We'll briefly touch on cost, including point of service, and then I'll round out my part of the presentation with how to get access resources. I'm not going to spend too much time slide by slide, but I definitely want to hit the highlights for each one, leaving as much time for questions as possible. So before we move on, I really want to just remind everybody that mental health can affect us in all kinds of ways. It can affect our mood, our behavior, our attitudes, how we interact with people. And I encourage everybody that if you think that you might need some services, that you should seek them because TRICARE has a very robust benefit. All right, let's go to the next slide, slide 4. TRICARE, like I said, covers mental health and substance use disorder services, and they're available to the active duty service member, their family members, their dependents, their retirees dependents, anybody who is TRICARE eligible. And again, you can access them at any point in time. So if you're experiencing symptoms that are getting in the way of your job or your family or day-to-day life, please find us. Okay, so TRICARE then reimburses when services are medically or psychologically necessary. So you'll hear me say that multiple times throughout today's presentation. But those are things for like, you know, anxiety, depression, substance use, grief even, so a whole host of services. We cover mental health and substance use disorders all over the world. There are some limitations overseas, mainly because maybe those services don't exist or their providers are not available, but a whole host of resources are available. So let me talk broadly, and then we'll get into more detail in the next slides. There are two essentially buckets of mental health and substance use disorder services. There's the outpatient services and then the inpatient services. And other slides will talk more about that, so I won't spend that time here. And how we get those through referrals and authorizations vary by where you are, what kind of TRICARE benefit you, whether it's prime or select. So yeah, we'll move to the next slide, please. I'm going to talk about the recent updates broadly. I'm not going to get too in the weeds with that, but there were 4 major categories of changes that happened. One was that TRICARE got rid of all limits on mental health and substance use disorder services, and what that means is there's no longer a day limit on services, a dollar limit on services. That's part of mental health parity. While TRICARE is not subject to that, we wanted to achieve the same goal, and so getting rid of all those barriers was the first objective. The next bullet on there is about cost sharing. Mental health and substance use disorder had a different cost share historically, so those have been aligned to be exactly what you pay for your other comparable services. So mental health and substance use are a specialty service, and they will be just like your other specialty care, podiatry, dermatology. They are all the same now. The next big change was in what services we covered. We added a whole host of services, and I'll spend more time in a minute, but the biggest one was in the introduction of the intensive outpatient program. I'll give more detail in a couple slides, but that was really kind of our missing service in the broad gap or a broad spectrum of mental health. And then the last one, which really more applies to our providers, but just for everybody's awareness, we made it easier for providers to become mental health and substance use disorder providers. So that's a huge asset to us now. Next slide is, what are our covered outpatient services? You can see from the list that we have the psychotherapy, but all three of the individual, group, family. We also have psychoanalysis, psych testing, med management, medication-assisted treatment. We have partial hospitalization, IOP. I mentioned IOP already, electroconvulsive therapy, and transcranial magnetic stimulation. Those are all office-based outpatient services. Go to the next slide. I'm going to start with the partial hospitalization program. It is a outpatient. It historically used to be an inpatient service, but we aligned it to actually fit what it does. It is an outpatient service where you come and go every day. The program is designed to meet your medical or psychological need. It is structured clinically to be less intensive than an inpatient service, so like not in the hospital, but more intensive than just going to your once-a-week appointments. A referral is always required for partial, no authorization, and mostly partial hospitalization programs are found in the U.S. There might be some locations in some of the U.S. territories, but generally overseas, we do not. There just aren't any. The one other point that I want to make is partial hospitalization is for both psychiatric and substance use disorder. All right, next slide, slide 8, is the IOP program. So again, IOP is an outpatient program that is it could be in the days, evenings, weekends. It's usually 6 to 9 hours over the course of the week, but again, it's more intensive than your office-based visit, but less intensive than an inpatient program. Again, it's about medically or psychologically necessary, and you do need a referral for this type of program. Next slide, slide 9. I mentioned that TRICARE covers medication-assisted treatment. We used to cover it only in a substance use disorder rehabilitation facility, which is a slide coming up, so I'll get there. But we also now cover it in an office-based setting or an opioid treatment program, and those are two big additions to the TRICARE benefit. Generally, these services are provided by a SAMHSA-recognized facility. SAMHSA is a Center for Substance Abuse Treatment. Nope, that's not it either. I will look that up and get to the rest of us by the end. My apologies. Eligible providers must have the DEA waiver, the Drug Enforcement Agency waiver, to provide certain drugs like Suboxone. But those are, those are generally like psychiatric nurse practitioners, psychiatrists. Yes. So then if we go to the next slide, we'll round out the rest of the MAT services. So an institutional provider or an outpatient facility that's not an office is our opioid treatment programs. And again, these are programs in an outpatient setting. They can either be connected to a hospital or they could be a standalone facility, but they tailor a program. It's obvious, again, more than just your regular office-based visit. You can come in for individual, you can come in for family sessions, but they also provide that medication assistance. And again, these are SAMHSA recognized facilities. Next slide, slide 11, is the office-based opioid treatment. And I just want to highlight the distinction that this is the psychiatrist's office or the individual provider, not an institution like a hospital setting. And again, there's the qualified physicians, nurse practitioners, physician assistant, but they have this DEA waiver that permits them to prescribe these specific types of medications. And we can definitely follow up with references on where things are. The acronym for SAMHSA is Substance Abuse Mental Health Services Administration. Thank you for helping me. I don't know why that escaped me. I say that all the time. But again, there are references. The TRICARE manuals have specific references of what the actual benefit is. So if anybody's interested, feel free to submit the question online and we can get you that reference. All right, slide 12. Now we're jumping over to inpatient services. Slide 12 is just the list. So we cover acute inpatient psychiatric. We cover psychiatric residential treatment center for a care for, and that's usually children and adolescents, and then inpatient and residential substance use disorder rehabilitation facility care. And you can see there are two types. There's the inpatient, essentially detox, and then residential care. So slide 13, let me take a few more seconds to talk about acute inpatient. This is really your short-term, intensive, you need more support than being out in the community, and it's intended to be a stabilization kind of facility. So you can go for an emergency or a non-emergency base. All non-emergency will require a referral and prior authorization. Anytime you go in for a psychiatric emergency, those are obviously you're not going to get a referral or authorization for an emergency, but the hospital will then submit a retrospective request once you get there. For continued stay is really how they know. But again, this is about really that the well-being of yourself in the community. You really need that 24-hour support from maybe the medical staff, maybe the psychiatric staff. This is really meant to be a short-term treatment to get you connected to the next right level of service. Slide 14 is about the psychiatric residential care. This is for children and adolescents up to age 21. This is, again, it's a longer-term residential setting placement. So really interfering with behaviors, social interactions, family interactions where the child would need 24-hour care, child or adolescent would need 24-hour care. Not that they would need to be in a psychiatric hospital, but they definitely are needing more support than like going home every day or going to school and then going to, your 1 hour a week of therapy. Again, you need a referral and authorization, prior authorization for residential treatment center care for kids and adolescents. Slide 15, this is the inpatient and residential substance use disorder rehabilitation facility. TRICARE covers this on an emergency and a non-emergency basis. Again, it's medically or psychologically necessary. Generally, an emergency is, let's say, some sort of maybe detox or some sort of medical stability need related probably to the substance use or misuse. The non-emergency service for inpatient and residential is also covered, but these, again, require referral and prior authorization. Again, to highlight, these are medically and psychologically necessary covered services. Next slide, 16. This is about active duty service members. Active duty service members generally get their care in an MTF unless there is no capacity or they're deferred to network, which means you have a referral and authorization. Active duty can get emergency care in the purchase care, but then they're immediately connected to the installation for continued care, and that might be to stay out in the network, but it might also be to come back to the MTF for that care. Again, prior authorization is always required for non-emergency care. All right, slide 17. Non-active duty duty beneficiaries. In most situations, prior authorization is not required for outpatient. Things like psychoanalysis or ECT or TMS, those require prior authorization, and that's statutorily and regulatorily defined. So we were able to remove some of the referral and authorization requirements for other outpatient services, but there are still some. Again, some also, the next bullet, some also require referrals. So the IOP, PHP, and OTP services, those all require a referral. And like I said, psychoanalysis requires prior authorization. Slide 18, non-active duty beneficiaries getting emergency care. Obviously, call 911 or go to your nearest emergency room if you are having a psychiatric emergency. Don't call the contractor; they are not going to help you. Go to the hospital. Again, in those instances, no referral, no authorization, but they will need to be contacted within 72 hours for continued care. Non-emergency inpatient care always get prior authorization. The next slide, slide 19, is essentially a cheat sheet for everyone. If you look at no other slide in the slide deck, this would be the one to go to when it comes to referrals and authorizations. The benefit is in the left column. The middle column is applicable to TRICARE Prime beneficiaries when it comes to referrals, and then the right column is about authorizations. Again, you could see office-based mental health and substance use disorder does not require a referral, and they do not require an authorization. And I want to take a minute to point out that that's another major change that happened in 2016, is that we got rid of the, it used to be called the unmanaged 8 policy, but it's you would need a continued authorization after the 8th visit. That has been deleted, and so essentially you can go to any mental health, substance use disorder, office-based outpatient provider, so that's your psychiatrist, psychologist, social worker, psychiatric nurse practitioner. You can go to any one of those folks in an office setting, and the contractor is monitoring that for medical and psychological necessity. Next slide. What does mental health care cost? Again, I mentioned it in the very beginning, it depends on what your beneficiary status is, whether you're active duty or a non-active duty, whether you are a retiree, what your health plan is, where you're getting the kind of care. So the next couple of slides spell some of that out. I will highlight slide 21 and 22. I will highlight the link at the bottom there, because that's really where to figure out exactly what you are looking for. But I won't spend too much time because I'm not the expert on TRICARE Select, but January 1st, we switched over from Standard and Extra to Select. And with that, there came a whole host of changes, and the ones I will reference here are about cost shares. If you have any more questions about TRICARE Select, I recommend you go back to the customer service reps who will put you in touch with the subject matter experts for TRICARE Select. But just to highlight, like I said in the beginning, mental health and substance use disorder are specialty care services. So we have outpatient and inpatient cost shares, co-payments. Again, Group A, Group B, those depend on, I think it's when you enrolled in TRICARE, and I'm sorry, when your sponsor became a service member. And so that's broadly where I will stop that part of the conversation, but you could see the TRICARE Prime folks pay 0 for the co-pays, and then the Select folks have a little bit of a cost share. Same thing on slide 22. This is the retiree slide. I want to highlight for everyone, regardless of what benefit plan you are on, everybody's always protected by the Catastrophic Cap. So at some point when you reach that, you then won't be paying any more out of pocket. That's a big takeaway. Because I know with the cost shares change, a lot of folks had maybe an increase in some services, and that's probably front-loaded your unexpected costs in the beginning of the year, but hopefully by the time that you get through the rest of your care, that those will decrease and then essentially diminish. On slide 23, I want to point out point of service. If folks are not familiar with point of service, there is a point of service fact sheet on the TRICARE.mil webpage, but I'll hit some of the highlights here. Point of service essentially gives you the freedom, a little bit more freedom, but it's essentially for TRICARE Prime beneficiaries, your requirements are that you have to have a referral for specialty care. Now, the caveat is that you're going to a network provider, and in some regions there may or may not be a robust network. So again, go back to your contractor, ensure that you are, if you have any questions, make sure that you are seeing a network provider to avoid point of service charges. Again, the third part I want to highlight that office-based outpatient mental health and substance use disorder services do not require a referral, but that's if you're going to a network provider. If you choose a non-network provider, you could be subject to point of service if there is a network provider available. So again, please contact your regional contractor. Well, I would just say do that anyway as a good habit, but contact them if you have any questions. And those questions, obviously I'm talking about point of service, but questions for finding care, identifying a specific provider, a specific type of treatment, geography, where's the closest one, they can help you with all of that. The last 3 slides are resources. So slide 24 is websites, phone numbers to the TRICARE.mil webpage, as well as other non-clinical services like Military OneSource. Those are great. I would also highlight this as a good reference to have. Slide 25 are your regional contractors, so your East and West region contractors, Humana Military and HealthNet Federal Services. And slide 26 is your TRICARE Overseas program and contractors. So all of those are available for you. So now I would like to open it up for our questions.
Okay, thank you. The first question reads, is a referral required for TRICARE Select for a TRICARE Select beneficiary?
So generally, no, but there are some services that require, regardless of of beneficiary status, that require a referral or authorization. Something like ABA it doesn't matter if you're a prime or standard beneficiary. It's a program that requires referral and authorization.
Okay.
And possibly inpatient services.
Okay, thank you. Is U.S. Family Health Plan coverage on this subject the same as TRICARE?
Yes, the benefit is the same. It's just a different. You've chosen a different way to render the benefit. Render the service. So they're just another select group. It's a network of providers in a select area. So the benefit is exactly the same.
Okay, so when a referral is required, who is authorized to provide the referral for the TRICARE Select beneficiary?
Any referring provider. I mean, how a referral is issued and processed is no different between the different plans. They just have to go. Your physician makes a referral. The referral goes to the regional contractor. The contractor, if there's an authorization that gets issued. So there's no difference in the benefit part of it.
Okay. For the active duty service member, does that include the child's needs authorization?
I don't know that I understand the question. What do you mean, active duty service member, the dependent beneficiary who needs?
Yeah, that includes any beneficiary, any service that requires an referral and authorization, no matter who it is, it's the same requirements.
Thank you.
Okay. All right, the next question. I'm enrolled in TRICARE Retired Reserve. Last year, I received detox hospitalization, followed by extended inpatient treatment at Betty Ford. As part of aftercare, I attended regular group therapy sessions conducted by a licensed drug and alcohol counselor. To date, I have paid out of pocket, not knowing that the service might be covered by TRICARE. Is it?
So I would say TRICARE can retrospectively pay up to 1 year of claims. So submit to your regional contractor for, and their claims processor for payment.
It will only be paid once again if it was medically necessary care
Correct.
that meets the criteria.
Correct. So the contractor will do a retrospective medical necessity review, and that'll be pulling records. It'll be kind of evaluating the type of care it was, and then they'll pay it accordingly.
This is Francine, and I work customer service, and I think in that element too, if you have claims, TRICARE can accept claims if it's more than 1 year from the date of service, and in this instance, you can even go back to those providers and ask them to submit the claim to TRICARE if it's less than 1 year from the date of service, because then they will include the diagnoses and other things that you as a beneficiary may not think to include. So you can either file the claim yourself, or you can go ahead and ask providers to file on your behalf. They don't have to, but you can ask them to.
Okay, next question reads, are eating disorders considered mental health issues, and are they covered under the inpatient and residential treatment rules? Are the costs the same as substance use disorder and mental health costs?
So eating disorders are considered mental health diagnoses. They're found in the same manual of the text, the Diagnostic and Statistical Manuals for Mental Disorders. So yes, they are a covered benefit, and they are covered both in inpatient and outpatient settings. So the cost shares are applicable to the particular provider type, institutional or individual professional provider. And there's a TRICARE policy manual reference too, if you're interested in that. Or I could just tell you it's Chapter 7, Section 3.15. Sorry.
Okay, thank you. Next question. I can't find a network provider that treats substance abuse. How can I find someone?
So this is an interesting question. Remember, there's no referral and no authorization requirements. So you could go to an outpatient provider. However, if they're not on the TRICARE rolls, if you will, they will need to do so. So if you run into that problem, my first call would be call TRICARE, the regional contractor, and they will help identify a provider for you. That's their job. That's what they're contractually obligated to do, to find you a provider. So if there isn't one, or you're having a hard time finding someone who is TRICARE authorized, your next call should be the TRICARE regional contractor.
Okay.
And this is Francine. If there is a particular provider in your area that you're familiar with or whatever, you can also give their name to that contractor to see if they can approach them and see if they'll participate and or become a contracted provider.
The next question, how often do you try to update the list of available providers in the network?
So the regional contractors are contractually required to update that. I believe it's quarterly. It may I think the language, well, I can confirm that, but I'm pretty sure there's again, another TRICARE manual reference. I believe it's Chapter 5, Section 1. But there is a requirement that they are supposed to have a network provider registry. And I highlight network because it does not capture non-network providers.
Okay, thank you. Let's see, the next question, who do we contact to do an authorization for inpatient mental health, and is there a particular place to verify that the patient does or does not have TRICARE?
So all of that should be done by the provider. So you, the beneficiary, will see the referral. That referral goes to the regional contractor. The contractor issues the authorization. And then your provider, the rendering provider, so when you go to that inpatient facility, it only behooves them to ensure they're going to get reimbursed, to double check your eligibility, your payment requirements, your status. So that's really on the provider to do that. And especially if you're a prime beneficiary going to a network provider, you're protected that way.
And Stan, it sounds like that question may have actually came from a provider group, and if so, as a network provider, you should have access to the database that allows you to check the eligibility of a beneficiary, but at the same time, you should be also calling the regional contractor to validate eligibility for beneficiaries as well. Because even those that carry a TRICARE card, that does not say that they are eligible for benefits. Their military ID card is what validates them as having benefits, but again, you should be contacting the regional contractor to validate eligibility.
Thank you. Next question reads, does this information apply to TRICARE for life? My son has both Medicare and TRICARE. The reimbursement for POS is greatly reduced when using a Medicare opt-out provider, even with authorization.
So remember, Medicare is the first payer when it comes to the TRICARE benefits, so TRICARE picks up the remaining part. But there are lots of other details there, but the only other thing that I can think of is if Medicare is not a covered benefit, then TRICARE picks that up. Well, it's right, if it's medically necessary, correct.
Yes, and when you say an opt-out provider, please keep in mind that if it's an opt-out Medicare provider and Medicare is not paying on it, TRICARE is going to pay what we would have paid a secondary payer, which is 20%, and you would be responsible for that 80%. So it would be wise to try and see a Medicare provider, that accepts Medicare assignment, and then the benefit followed up by TRICARE for life.
Okay, thank you. The next question reads, when I have called to get an authorization, I will be told I don't need an authorization for my child as they are not the active duty person. They have said the family member does not.
I think it depends. Well, the first question is what type of service are you requesting, and then again, if an authorization is required for that service, it doesn't matter who you are. An authorization would be required. So,
I think active duty service members clarify do have to. If they go get outpatient care, they still have to get a referral off, but the child would not now.
Correct.
And as she verifies, then it depends on what the service is that you are seeking, because there are those services that require, regardless who you are and your status, that require an pre-authorization.
So it's still good to always call.
Yeah, it's good to always call, but so just validate.
I'll add one more piece. The regional contractors may conduct other sort of reviews and requirements above and beyond what we at DHA require, and that is for medical management and medical and psychological necessity reviews. So be aware of that too.
Okay. Next question reads, does TRICARE cover music therapy for post-traumatic stress disorder?
No, that is not a covered benefit under the TRICARE benefit.
Okay. Next question reads, I've asked my drug and alcohol counselor if he's ever submitted a claim to TRICARE. He replied that he has not, so I assumed he's not in network. How would he become a part of the network?
Well, he could file the claim and that could start the ball rolling, but technically reaching out to the regional contractor, I guess he as the provider should be the one doing that, because you as the beneficiary will not necessarily know like the tax ID number or some of the other required fields. But the regional contractor can do a retrospective kind of, I guess, TRICARE authorization status, or TRICARE authorized provider status, but I get the ball rolling.
Okay, thank you. The next question reads, if my son is a dual diagnosis RTC, can he sign himself out at age 18?
Well, so I'm assuming when you say dual diagnosis, you mean a mental health and a substance use disorder diagnosis. And under TRICARE, residential treatment centers do not cover substance use as a primary diagnosis, so that may or may not be a first element. I guess it also depends on what state you live in, what the state laws are about child or adolescent's ability to make medical decisions. So I can broadly speak, but can't answer the specific. And was there a third part to that question? I forget.
No, and that's the biggest thing, Chris, is it is based primarily on the state law that governs. Yeah, that's the biggest point.
Okay, next question. If we ask our primary care provider for a referral to a mental health doctor, how long should it take before we have the information for a mental health doctor?
Well, remember, you do not need a referral to a network provider for mental health service, outpatient office-based mental health services anymore. So the short answer is it takes as long as it takes you to go to the website and find a provider. But having said that, if the list is not up to date, then you would want to contact your regional contractor. I have heard that some providers are still insisting on writing referrals. That's fine. That can get you connected. I think if you have I think the MTF requirement, if you're going to an MTF, the requirement is that the referral has to be adjudicated within, I think, 24 or 48 hours. The referral has to be, so it has to be received and acknowledged, and then up to 28 days to get that appointment. So your referral, so if you're not getting care within 28 days or you don't have an appointment set, I would contact your regional contractor immediately.
Look for the author. Look for a notification from the contractor that
if a referral has been put out, contact that regional contractor.
Okay, next question. Can you tell me where in the manual it states no authorization is required for partial hospitalization and intensive outpatient programming?
So in the manual, it only says referral required. It doesn't. It's the absence of the statement that makes that true, if that makes sense. So I mean, I could tell you the chapter. It'll be chapter 7. Section 3 point, I'm looking pretty quickly, but they specifically say what you need. It doesn't say what you don't need.
Okay, thank you. What is the difference between a referral and prior authorization?
So a referral is something issued by the provider, so your primary care. It is the document that says, I think that based on this diagnosis, you need to go to this specialist. So like a broken bone, you go to the orthopedist, right? And the primary care writes the referral for that specialty care. The authorization is the regional contractor has reviewed medical psychological necessity and then authorized that care based on that referral.
And for TRICARE purposes, when a contractor reviews a referral, they're looking to see if it's a covered benefit. When they review an authorization, they look to see is it a covered benefit and is it determined to be medically and or psychologically necessary. So sometimes there's a difference. Because we already know what services require authorization, they expand their review. If it is a service that doesn't require authorization, they'll just check to see coverage.
Absolutely. I guess a real life example would be, so I may think I need mental health services, but then I don't necessarily need that level of care. So my provider might say, oh, I think you should go to inpatient, and the contractor will say, actually, your symptom presentation and the description and supporting documentation and treatment plan suggest that you need outpatient services. That would be what the authorization could achieve.
Okay, thank you. The next question reads, I believe TRICARE West just went through an overhaul. I'm having difficulty finding in-network providers. Do you know if the website has been fully updated?
I think, yes, we're aware the transition was tough for a lot of people. I think that we are still trying to improve and refine processes. Remember, the contractors are required to build adequate networks, so I would just keep contacting your regional contractor if these issues persist.
Okay. The next question reads, how do I know if I need mental health help?
So, I think if you are recognizing that you're having difficulties throughout your day, maybe a difficulty with your family, your spouse, your coworkers, maybe you're having trouble paying attention, or you're feeling lethargic, or maybe you find yourself worrying and doing things that maybe I would call, quote, out of character. You know, those are maybe signs and symptoms for you to go seek an assessment by a mental health professional. They can then help you through, what do you actually need? Is this a diagnosis, or is this a difficult time? Would you be better supported by a non-clinical counselor? So there are lots of options that TRICARE covers. Make an appointment, get yourself seen, let them help you decide where you are and what you need.
Okay, thank you. The next question reads, I believe this is a follow-up. Using an opt-out provider, because the provider has treated my son for over 10 years, so she is the subject matter expert on my son. So are you saying my son will have to see a less qualified psychologist? Tried a TRICARE provider who told us he wasn't qualified to treat him. Who do I speak to find a qualified in-network provider?
So I'm not going to speak to this individual provider's education, credentials, history. I think that would be unfair to everybody. I think that there are TRICARE requirements, and those are regulatorily and statutorily defined. Things like types of programs you went to, how many years of training education, licensure requirements. Some of that's even dictated by the state. So I encourage this listener to, again, reach out to your regional contractor, because those are all defined on what those requirements are. Yeah. Oh, and Medicare, yes.
Okay, next question reads, I'm active duty and do not want to go to an MTF due to privacy, mental health stigma from leaders, etc. What are my options?
So active duty service members are required to get their care, all of their care, from an MTF or with a referral and authorization to the network. You cannot see a provider on your own. Actually, that's a personnel matter, and that can be followed up by disciplinary action. So if you are seeking, or if you are rendering treatment without a referral or authorization, you just keep in mind that you are subject to your service taking action against you.
And Stan, just to put it on and to piggyback on the personnel side for those active duty, Title 10, Chapter 55 outlines the requirements for care for all active duty service members. Line of duty is a big factor in that, and to make sure that fitness for duty requirements are met. So that is why all active duty are required to get their care through their assigned primary care manager.
To say it in a mental health kind of way, it really is in the best interest of your command to know how you're doing, and the only way they can do that is if they can get connected to your healthcare providers. Like I said, I'm a psychologist. I think that if you are really going through something and it's impairing your functioning, it's not just you, it's your unit, it's your command. I think it behooves you and your entire unit to make sure you're getting the right care at the MTF.
Okay, thank you. Next question. Is a licensed marriage family therapist covered under psychotherapy?
So LMFTs are not I don't believe they're a recognized provider category. That's the one. Oh, you're right. They do. You need a referral. That's an example, like supervised mental health counselors and pastoral counseling. Those both require referrals for office-based outpatient mental health visits. So yes, but again, for treatment for reimbursable services that are medical and psychologically necessary, there has to be a diagnosis of an individual. Marriage counseling is not a diagnosis.
So does TRICARE cover marriage counseling?
No. One of the individuals must have a diagnosed condition according to the DSM. So you could go for family therapy, but somebody has to have a diagnosis that's impairing the marriage or impairing some sort of functioning. But no, it's not. Marriage counseling in and of itself is not a covered benefit.
Okay, thank you. Next question reads, as a provider, when I'm getting authorization, do I need to request the initial 8 visits? The website is confusing on what to request and how to request. At our clinic, we are the PCP and the outpatient mental health provider.
So again, the unmanaged 8 policy has been deleted. So if there is some reference out there to that, I guess send it to us so we can follow up. Yeah, I'm not sure if you're looking at a manual, if you're looking at a TRICARE website, if you're looking at another, I don't know, provider website. I know Humana originally had it in January, but that has since been corrected. I'm not sure if HealthNet ever had it, or, that incorrect information, but please let us know where you might see it, because that should not still be out there.
And they can recommend a length of time, but it will be really the mental health counselor that determines. I mean, it'll be the regional contractor will authorize a certain number of visits.
Correct, based on medical and psychological necessity.
Next question reads, is intensive outpatient treatment for adolescent substance abuse addiction covered? 8-week program costs $3,000.
So again, all services are based on medical psychological necessity. If somebody submits a treatment plan that says, I need 10 weeks of therapy, the regional contractor is supposed to identify, is it really 10 weeks? We're going to give you a certain amount and we'll check back with you on the treatment plan. I would be really cautious of these programs that say 6 weeks, 10 weeks, because mental health care is based on the individual. And yes, there are evidence-based protocols, but those are based, reimbursed care is based on medical or psychological necessity.
Okay, thank you. Is the regional contractor contact information available on TRICARE's website?
Yep, and it's also available on the last few slides of this presentation.
Yeah, I have slide 24 up now that
Perfect, thank you.
Okay, let's see here. For those of you who are requesting the presentation slides, there was an email that went out to everyone who registered, and the PDF copy of the presentation was attached. But if you did not receive that for any reason, go ahead and just send me an email at military1source at moswebinars@military1source.com, and I'll provide that PowerPoint slide to you. We do have another question that just came in the queue. The information is on the HealthNet Federal Service website. This is where it asks if you are wanting to request the initial 8.
I can take that back to HealthNet. I just need to make sure that they update that, because that is the unmanaged 8 actually has been gone for over a year. So
is that the old HealthNet website or the new website?
That is also a good question. I don't know if you heard the question. It was, is that the old HealthNet or the current HealthNet website? But we'll look. Stan, before you move on.
Okay, she just responded and said it is on the portal.
So I'm going to have to take that back to HealthNet, because I'm not sure. I will take that back. because I don't
Okay.
have access to those folks, especially right at this moment. The one thing I want to highlight that I didn't spend some time on, and everyone will bear with, is telemental health services. I want to remind everyone that telehealth is a medium, like a mode of which one can render care. It is not a type of care. So when trying to find somebody, a provider who offers telehealth, you have to call them and say, are you set up to render, psychotherapy through the audio visual capabilities? So the provider generally needs to be set up. And if you are looking for a telehealth option, again, contact your regional contractor, because they'll be tracking those providers who are already hooked up to some sort of platform where they can link you to telehealth.
Okay. I would like to thank Dr. Christina Biena for sharing her invaluable experience and expertise. And as always, I'd like to thank our customer service team, Calvin and Francine, for their participation in answering questions. And not to leave out our attendees, thank you for joining our webinar today. And if you find yourself having questions after the webinar is over, or if we were unable to answer your question today, please contact your regional contractor. Also, many of the answers to questions related to the TRICARE benefits can be found on the TRICARE website at www.tricare.mil. This concludes our webinar today on TRICARE mental health and substance use disorder services. Thank you all for joining, and have a great day.